That clicking and pain in your jaw isn't normal. And it's because your atlas is off. Let me show you how. So you went to a dentist and they told you you have a TMJ issues and you have a jaw problem. But I want you to pay attention to this. Sometimes the problem is not in the jaw itself, but it's actually in this part of your neck directly under your skull, which we call C1. C1 is atlas, and when this bone rotates even few millimeters out of position, it physically shifts the skull to one side. And when the skull is shifted to one side, it loses proper balance. Thus, it irritates the nervous system, causing it to send extra signals to your jaw muscle. Think of it like a computer glitch. Let's say your brain sends 30% more nerve impulses down to your master muscle on the left than the right side. Okay, so think about it. One side of your jaw muscle has more impulse. Therefore, that side that has more brain messages or more nerve impulses will contract just a little bit more. That causes the left side to stay constantly contracted, because one muscle is now significantly tighter than the other one. Then what happens is your jaw will just get pulled to one side, okay? And that's where you get this clicking, that every time you open your mouth, you get click, click. That's because of uneven muscle contraction, and also could lead you to grinding, lead you to pain, and then if that's never been corrected for a long time, then it leads to more of degenerative issues. So look at this. We can actually see the head tilt from one side before we make the correction. And what we do is we measure the head alignment between the head and neck, and we get the alignment back to as close as possible to be even. And you can see this is before and this is after. Same patient, same visit. Right after, when we adjust the atlas back in alignment, the skull is leveled and the nervous system stop overfiring and sending these messages. The muscle relaxes in the body, the jaw joint finally loaded evenly, okay? So it's not one side pulling into the other side. So your dentists are doing their best job. They're treating the symptoms and that's what they're focused on. But the question is, why are the muscle firing unevenly? And if you really focus on your body, you're gonna notice that your traps are firing unevenly. Your lower back muscle firing unevenly. Your hips are uneven. Maybe when you sit down, you always have to cross your legs because the muscles on your body are firing out unevenly. And dentists are not gonna look for the cause. They look at the teeth and that's their specialty. But we have to look beyond that and see why are the signal coming unevenly, and we're going to correct that. Most of the time, the cause is right here at the top of the spine. So if you have a TMJ symptoms and you couldn't find any solution and you've done physical therapy, you've tried different mouth guards, consider a consultation. Let's talk about it. Let's see if it is something that it is an upper cervical issue and we can help you with it.